This is a brief presentation on the genetics of epilepsy. So epilepsy is defined, as you've seen in many of these lectures, as more than one seizure. Both infantile and childhood adult onset epilepsy may have causes including metabolic diseases, brain malformations, infections, as well as single gene causes. One of the most common single gene causes is an abnormality in the membrane electrolyte channels. Epilepsy occurs in about 1 to 2% of the population. 70% of childhood epilepsy has an inherited cause. Genetic testing should be considered in any child with epilepsy. So in childhood epilepsy, 24% of children with epilepsy will have a chromosomal microdeletion. And 40% will have a single gene cause. So those two together represent the 70%. Adult onset, while there are single gene causes of adult onset epilepsy, the incidence of single gene causes is lower in adults than children. Additional causes of seizures in adults include trauma, alcohol abuse, brain tumor, stroke. So as the brain gets damaged, as you get older, there's a lot of other things that can happen. Inherited causes of epilepsy should be considered in adults if there's a family history of non-traumatic seizures. So non-traumatic seizures, again, if somebody had damage to the brain and then they had seizures, that's a traumatic seizure. So we do consider testing for adults after that. One thing I want to go back to with the microarray is a young baby, you're not going to maybe know that they have developmental delay because they're too young to know that. So single gene or Mendelian disorders occur when a mutation of a gene is responsible for the seizures. There can be variability about, both people, two people in the family having that gene, one person having a lot of issues with seizures and the other one not so much. And over time, we'll understand this better. The risk of epilepsy in the general population is approximately 1 in 100, pretty common. There are a number of genes associated with inherited non-syndromic seizures. So what I mean by non-syndromic is the baby doesn't have a small head, extra fingers, a heart defect. Those are syndromic things. Many of these genes are associated with ion channels, including neurons, and uncontrolled epilepsy can lower IQ in children. So I just want to show you this. So uncontrolled epilepsy, the brain is continuing to grow. Children's brain are growing in size for the first couple years and actually developing with regards to neurons for much longer, maybe even to adolescence. And so a child that has uncontrolled seizures during childhood can go from a normal IQ to severe cognitive deficits based on the seizures and the inability of the brain to grow correctly. Whereas adults, if they had a tumor or something else and they have uncontrollable seizures, yes, those cause a lot of issues, but they don't lose intelligence. Single gene syndromic causes associated with seizures include tuberous sclerosis, Rett syndrome, Fragile X, and leukodystrophy. At the end of this lecture, there are some material that is voluntary for you, but it will not be covered on the exam reviewing these disorders. We will be doing Rett's next year. Single gene causes of non-syndromic epilepsy. Again, a kid that otherwise looks completely normal and there's no other abnormalities except for the seizures. One is a GLUT1 or glucose transport abnormality. The GLUT1 gene, or otherwise known as SLC2A, affects the transport of glucose into the neurons. When non-functioning, glucose can't get into the cells. So you have sugar in the blood cell and it can get into other cells, but it can't get into the neurons. And neurons get really, really mad if they don't have sugar. And when they get really mad, they seize. So these children start having seizures beginning in infancy. Normally, glucose is transported into the cell through glucose transporters. When this receptor does not function correctly, the cell cannot transport glucose into the cell. So even though it's normal on the outside, you can't get it on the inside. The lack of glucose for energy in the brain cells results in seizures. So the The cells love glucose the most. These genes are inherited in an autosomal dominant fashion. Only one copy of the gene and you can have these features. Management, ketogenic diet. This improves seizures by changing the energy source from glucose to ketone bodies. So let's look at this. So the ketogenic diet is a diet high in fats and proteins, limited carbohydrates. This makes the body believe it's in a fasting state, so the liver starts breaking down fats and making ketones. And ketone bodies can cross the blood-brain barrier and be used for energy. So if you remember from the previous food to fuel, we talked about if you had a fatty acid oxidation disorder, this, of course, diet would not work for you. But normally, when cells need energy, ketones can be used. So you need to trick the body and make ketones. So the earlier you make this diagnosis, the faster you get this child on a ketogenic diet, the better the outcome is going to be. Because, again, the longer they seize, even though their brain started out normal, you're losing cognitive abilities. Dravet syndrome, or myoclonic epilepsy of infancy, seizures begin in the first year of life. Often the initial seizure is associated with a fever. So you think, oh, it's just a febrile seizure, but then things get worse. 85% of patients with Dravet syndrome have a mutation of the SCN1A gene, and this codes for a sodium channel. It's inherited, again, in an autosomal dominant fashion. The vast majority of these seizure non-syndromic seizure disorders are dominant. Seizures progress to tonic-clonic or even absence, and the frequency actually decreases as adulthood. However, if the patient had uncontrolled seizures as a baby, they're going to have cognitive delays even when the seizures stop because there's been damage to the brain. So as I said, the SCN1A gene is inherited and autosomal dominant. Most cases are de novo, however, they can be inherited. So here we have a family history of this baby has Dravet syndrome, but the mom, benign epilepsy means they have seizures, but it hasn't really affected them that much. So she has 3 children. This one had seizures, but is growing just fine. Her father had seizures. Her sister never had seizures, but had a child with seizures. So sometimes somebody could inherit this predisposition and just never really have a seizure, but then be able to pass it on. But this individual, again, she has seizures, maybe a couple when she was little, well controlled, but then she has a child and it's not well controlled, and they end up with severe cognitive deficits because of that. If a parent has idiopathic epilepsy, there's a 9%, so we can't figure out why. There's a 9 to 12% chance that the child will develop epilepsy at some point in their life. This is actually more large data looking at populations and not as much, just in the general population. Genetic testing is recommended for all infants and children who develop epilepsy. In some cases, as we were talking about earlier, a specific management, such as a ketogenic diet, can be helpful. Controlling seizures during infancy is critical to prevent cognitive deficits. So here's a USMLE-like question that I took from one of these books. I always say when I put in these questions, these books, I take them out of, they're not refereed questions, so sometimes you might argue about the answer, but I'm just going to give it to you because it doesn't count for anything. A 2-year-old female presents in status epilepticus. Her first seizure was at 4 months. It was associated with a febrile illness. She had a second seizure at 9 months. The second seizure was not associated with a fever. Since that time, she's been having 2 to 3 seizures a week. And actually, seizures, you can lose, I think, up to 8 IQ points every time you have a seizure when you're a young child. EEG shows generalized spike and wave pattern. Her gross motor and cognitive development is delayed. She smiled at 2 weeks. She sat up at 6 months, but has lost that skill after the second seizure. She's now having difficulty with POE feeding and requires a G-tube and a Nissan. She does not pull to stand, and she has no verbal speech. The family indicates the mother had a febrile seizure as a child. She had no additional seizures. A clinical diagnosis of Dravet syndrome is considered. Which gene is associated with this diagnosis? And the answer is SCN1A. UEB3A causes Angelman syndrome, which we'll talk about next year. The GLUT1 would be the disorder with the glucose transport and the ketogenic diet, and MECP2 causes Rett syndrome. And again, we're going to go through the rest of these over time, but that is the answer to this question. So that concludes this lecture.